One of the most difficult things I have experienced working in the hospital is having to ask somebody to pay their bills even though their patient passed away. It will be understandable that, okay, you helped the patient, you did your best, the patient is recovering well, but the family is having problems paying their bills, especially in a context where we don't have a lot of insurance and more than 70% of hospital payments are done out of pocket from people who are relatively not so well to do. So imagine a situation where after somebody has lost their parent, lost their mother, lost their wife or their baby, you have to within the next few minutes. It will be insensitive to start asking, you know, them to pay their bills right at the moment of death. But it doesn't take too long if you think about it. The corpse is taken from the bed to the morgue or the mortuary, and less than an hour or two after that, bills are supposed to be paid. I don't know if you have something worse than that, but the look in the eyes of the people. Now, if the bill is a small amount, it doesn't cause that much trouble. You know, people spending 2 weeks in the intensive care unit and still passing away with bills so huge, they are in six or seven figures, and then the family has to pay despite their patient passing away. Now, it's not always the responsibility of the hospital or the attending physicians and nurses that the patient passes away. In some cases, there is negligence, but many times they try their best and the patient still passes away. So it's not about guilt. It's not really an issue of guilt. It's more an issue of compassion, looking at a person who has lost someone and is grieving and demanding that they pay huge sums of money. I can't imagine something as hard as that. If you have something hard, I drop it in the comment section.